Hello, I'm Colonel David Zananti, Commander for Womack Army Medical Center, and I'd like to take a brief moment to welcome you to the Womack Army Medical Center Maternity Fair. We've done these in the past, face-to-face and virtually. Unfortunately, the last year with COVID, we were only able to offer it virtually. This year, we are offering it again, face-to-face and virtually for all of you online. We've got a great series of events lined up. We hope you enjoy it.
Hello, my name is Lieutenant Colonel Karen Wilson, and I am the Department Chief of the Gynecologic Surgery and Obstetrics Department. I'm boarded in both obstetrics and gynecology and maternal fetal medicine, and I have devoted my career to caring for women in their pregnancy, and I'm very happy to be with you today. I want to first welcome you to the Womack Army Medical Center Maternity Fair. This is the second year we've been able to host this on a virtual platform, and we are excited to have the opportunity to share so much information with you all. I have been asked to speak on a topic that is very near to all of us, COVID. So many of us have been affected by this illness, whether it has been just through how we go about our daily activities to losing loved ones. And there are still many unanswered questions as to how this virus will continue to impact society and our health. This is an especially difficult time for women who are trying to get pregnant or who are pregnant, and every woman wants to do the best thing for their unborn or developing child. So I wanted to talk about the impacts of COVID on pregnancy. There are still many reports that are coming out on how COVID has affected pregnancy. After the first wave, we now know that pregnant women who acquired COVID had up to a 30% risk to deliver preterm and a 16% risk to having a baby smaller than expected. These women were also at increased risk of developing a condition unique to pregnancy called preeclampsia and would also potentially need a C-section. Also, when women developing severe illness due to COVID-19 and are pregnant, we were very limited in our ability to treat them due to the pregnancy. This limited ability to treat them optimally can impact many aspects of the mother and the child's health. Despite all these risks, many women are unsure about COVID vaccination. Early in our vaccination campaign, we had very little data on the impact of COVID vaccination on fertility and pregnancy outcomes. After 8 months of vaccination, over 100,000 pregnant women in the U.S. have been vaccinated, and with some of this information, we now know that COVID vaccinations have not impacted fertility or caused any impact to the baby. A recent New England Journal of Medicine article reported that women vaccinated had a 13% miscarriage rate. Historically, the average risk of miscarriage for women is 20%. COVID-vaccinated pregnant women also had a 9% preterm birth rate, a 3% risk for low birth weight of the infant, and no increased risk of congenital abnormalities. All these rates are below the national average and well below reported rates in women infected with COVID. I impart this information to you as a medical personnel fighting through a second wave of severe COVID illness. And the only way to protect you, your current pregnancy, and future pregnancy is to vaccinate. So I'm strongly urging all women desiring to become pregnant or currently pregnant to get vaccinated. If you need any more information, please reach out to our clinic. We'd be more than happy to discuss with you. And please enjoy the rest of the maternity fair and all the great information provided.
Hello, my name is Lieutenant Colonel Jennifer Givens, and I currently serve as the Chief of Maternal Child Health, leading nursing operations in labor and delivery, the neonatal intensive care unit, the women and newborn care unit, and lactation services at Womack Army Medical Center. Welcome to our virtual maternity fair. This event will offer you the opportunity to learn more about the maternal and newborn services provided here at Womack. You will also get the opportunity to learn about many other support services offered here in our community. We hope you find this information helpful. Thank you for choosing Womack, and we look forward to caring for you and your growing family.
Good day, Fort Bragg families and caregivers. My name is Darla Masters, and I'm a physician assistant with the Epidemiology and Disease Clinic, Department of Public Health in Fort Bragg. I'd like to share some information gathered by our infection control nurse in the EDC, Ms. Karen Wells. For this year's virtual maternity fair, we decided to focus on food safety concerns, primarily salmonella and hand washing. We have stocked a few of the goodie bags, just this small. They have available information in English and Spanish, and it talks a little bit more about the items we're going to discuss today, as well as safe formula preparation. In the midst of our current COVID-19 pandemic, we have tremendously improved our infection control awareness and practices at home, in our schools, and even the work environment. Many of you may have heard of salmonella outbreaks on the local news or read of these in print. Did you know from 20,000 to 2018, we've had 76 outbreaks across the United States. Of these, 5,000 people got really sick and 950 had to be hospitalized. Unfortunately, 7 people died from salmonella infection. Those most at risk for severe infection include our pregnant women, the very young, as well as our older population and anyone with an immunocompromised condition. From 2018 to 2020 across the United States, we had 17 documented salmonella outbreaks with over 1,000 hospitalized in just those 2 years and 1 death. This year, in 2021, we have had 672 illnesses due to backyard poultry, as well as 2 deaths recorded so far. Of those sick this year, 1 in 4 were children under the age of 5. So again, we want to reinforce the importance of hand washing, whether it's before cooking, preparation, petting zoos, or in our backyard. So what are the symptoms that we should be concerned about, and what can we do to prevent severe infection? For salmonella, it's usually exposure, either working with poultry, playing in the yards, at a petting zoo, or improper food prep at home. The infection onset can be as early as 6 hours to 6 days after contact and includes fever, abdominal pain, cramping with diarrhea. For most healthy adults, these symptoms can be mild and go unreported. But for anyone with a fever above 102 with bloody diarrhea, we would ask you to please follow up with your primary care provider. The basics for food safety and prep, these are recommended from the Food Safety and Inspection Service, and they comprise 3 C's and 1 S. Clean your hands. The work surface, the utensils before and after use. Cook your meats to the safe minimum temperature, not relying on color or odor as an indicator of safety. For salmonella, there is no color change or odor change on our meats and vegetables. Make sure to chill your foods appropriately. Our refrigerator should be at 40 degrees and below. Our freezers 0 degrees or lower. Make sure to separate raw meat, eggs, and vegetables from one another. In preparation at home, if you don't have 2 separate cutting boards, please make sure you wash in between use with soapy water. The grocery stores, we can use the plastic bags to make sure that we keep our foods separate and the juices don't intermingle with one another. Now, the Food and Safety Inspection Service reports that 1 in 6 Americans get sick annually. Over 3,000 die. So we want to continue to practice food safety, hand washing. Congratulations to our families, and we wish you an awesome autumn from your Epidemiology and Disease Clinic, Department of Public Health.
Hi, my name is Shannon Gettings. I'm a registered nurse with Army Public Health Nursing here at Fort Bragg. At Public Health, one of our missions is our tobacco cessation program. Tobacco use during pregnancy can cause serious problems. Your baby would be at risk for preterm delivery, birth defects, and even sudden infant death syndrome after birth. It is ideal to stop using tobacco prior to getting pregnant. However, it's never too late to quit. There does seem to be a common misconception that vaping or e-cigarettes are a safer alternative to tobacco use or smoking, but that's simply not true. Vaping also poses serious risk to you and your baby. For more information about how to quit, please call us at 910-907-8241 or speak with your OB provider to find out how we can help.
Killed it.
Good morning. Congratulations on your pregnancy. My name is Carrie Baird and I am a population health nurse. I'm here to share important information with you about something that will happen after your baby is born, well-child appointments. So, what is a well-child appointment? Well-child appointments are comprehensive visits with your medical provider that cover many important things such as your child's growth and development, nutrition, safety, and emotional and physical well-being. These appointments are scheduled at specific times in your child's life so we can evaluate their growth and development and address ways to keep them healthy. You can expect to have well-child appointments when your baby is 2 weeks old and when they turn 2 months, 4, 6, 9, 12, 15, 18, and 24 months old. At the appointment, your child will be weighed, measured, and receive a physical exam by the medical provider. Screening tests will also be performed to see how your child is developing physically, socially, and emotionally. Lastly, your child will receive immunizations if they are due. Your child's growth and development is evaluated by looking at developmental milestones. Developmental milestones are things most children can do by a certain age and includes how your child plays, learns, communicates, acts, and moves. It's important to remember that development varies greatly from child to child. The American Academy of Pediatrics makes recommendations for how you can help your child's development at every age. The appointment is a great opportunity for you to ask questions, discuss your concerns, or talk about any problems you have encountered with your child. Thankfully, many concerns are usually nothing to worry about, but sometimes we do have to dive a little deeper into a problem. Other times, the medical provider may discover an issue that parents were not aware of. Early interventions can make a big difference in getting your child the support they need before something small turns into a bigger issue. It seems obvious to go to the doctor's office when your child is sick, but regular doctor visits are just as important when your child is healthy. Initially, well visits occur frequently because infants are growing and developing so quickly. And your child becomes a toddler, well visits space out to annual checkups. Remember that every baby is unique, but your instincts are important too. The earlier a problem is detected, the earlier it can be treated. Your healthcare team is happy to listen, make recommendations, and provide education or resources if needed. By the way, we're all human and things come up in our schedules that cause us to miss appointments. However, it's vital that you call and reschedule. One missed checkup could mean a late diagnosis, and early intervention is key. To help you remember this information, please follow the link. Has your child had a well child appointment yet? There you will find a flyer with the appointment schedule, the immunization schedule, and other helpful contact information such as clinic telephone numbers and the central appointment line number. We've also included how to contact the nurse advice line, the emergency room, and the National Poison Control number, which we hope you never have to use. Thank you so much for your time, and again, congratulations and many best wishes.
Hi, my name is Ashley Ledford, and I'm the Centering Pregnancy Coordinator for the OBGYN clinic here at Womack. Centering pregnancy is an alternative form of prenatal care that is offered in the OBGYN clinic. Centering pregnancy is a group pregnancy appointment that includes about 6 to 12 moms-to-be with similar due dates. There is a total of 10 sessions, and each session is 2 hours in length. The group meets about every 4 weeks for the first 4 sessions and about every 2 weeks for sessions 5 through 10. Centering starts when you are about 16 to 20 weeks gestation, but only after completion of your nurse intake and new OB physical appointment with your provider. The appointment starts with moms getting their vital signs taken and taking turns completing tummy time. Because this appointment does take the place of your traditional prenatal appointment, your time with the provider is considered tummy time. During tummy time, the patient gets to listen to their baby's heartbeat and go over individual labs and concerns at the time with the provider. We have made a few changes to the process of the centering appointment due to COVID. All moms are required to wear surgical masks and eye protection during the appointment, are seated at least 6 feet apart, and are able to step to a designated area for a snack break if needed. Moms also have their vital signs taken prior to entering the group appointment setting. Once all the moms have completed tummy time in the group, all the moms in the group, as well as the nurse facilitator and provider facilitator, circle back up in the room for centering. At this time, there are topics related to pregnancy that are discussed amongst the group. The topics are covered through discussion, activities, and guest speakers. Some of the topics covered during centering pregnancy are pregnancy discomforts, breastfeeding, signs and symptoms of labor, pain management options for labor and delivery, newborn care, birth control, and postpartum depression. All of this takes place with your provider present. So if you have any questions or concerns, the provider is able to answer any questions. The appointment is lengthier in time to provide more time for education and questions. Another benefit to centering pregnancy is that you get continuity of care with your provider throughout the majority of your prenatal care. This means you get to see the same provider during your centering appointments. Centering pregnancy has been shown to lower the risk of preterm birth and low birth weights and increases the breastfeeding rate overall. Overall, centering pregnancy has been shown to increase the rate of better health outcomes for both mom and baby. Even if you have given birth, We would love to see you in centering. Your experience offers to the group a first-hand experience, and there's always something new to be learned about your pregnancy. You may be asking, how do I enroll? Moms will be screened for interest in centering pregnancy at their nurse intake appointment. However, if you know that you would like to hear more about centering or already know you desire to be enrolled in centering pregnancy, call 910-907-7394. We look forward to seeing you in centering pregnancy.
Hello, and welcome to the Nutrition Care Division. My name is Megan, and I'm one of the registered dietitians here at Womack. I'm excited to share just a small piece of nutrition with you. Calcium, vitamin D, and iron in combination with water are some key nutrients during pregnancy. Calcium is found in milk, cheese, yogurt, and dark green leafy vegetables. Calcium is important for bone formation and development. It is important to consume sufficient calcium. If the baby does not get enough calcium from your diet, then the baby can take calcium from your bones and teeth, which increases your risk of osteoporosis later in life. Next is vitamin D. The best source is the sun. Spending about 15 to 20 minutes outside with your skin exposed each day will help you get all the vitamin D you need. Vitamin D is important for the absorption of calcium and aids in bone formation. Moving on to iron. Iron needs are increased during pregnancy. The best source of iron includes meat, specifically red meats, as well as dark green leafy vegetables. However, iron is not absorbed quite as well from plants as it is from meats. Iron is vital in moving oxygen throughout your body as well as the baby's body. Water needs also increase during pregnancy. While pregnant, you need about 8 to 12 glasses per day. 12 glasses is equal to about 100 ounces or 1 gallon. Water helps to stabilize your body temperature, aids in delivery of nutrients, supports the increased blood supply during pregnancy, and helps the body recycle amniotic fluid. I hope you found this quick snapshot informative. Within Nutrition Care, we offer both virtual and in-person appointments to all TRICARE beneficiaries to include your new little one after delivery. We have included this information reviewed in your promotional handbag, as well as a guide on how to feed your baby from birth to 2 years. If you have questions or any nutrition concerns now or after delivery, please call 907-DIET. You do not need a referral to be seen.
Hi, I am Lachelle Lewis Fowler, the Humana Military TRICARE Community Liaison here at Fort Bragg. Humana Military is the regional provider for TRICARE benefits of the Eastern region. What we typically do here on post is provide briefs where we educate individuals on TRICARE programs and benefits. We also provide different resources related to TRICARE. Your number one resource is to visit humanamilitary.com, or if you have any additional questions related to your benefits, you can call our 1-800 number, which is 1-800-444-5445. You can also visit tricare.mil and enroll in a TRICARE online account. All of our information, publications, and briefs are located at tricare.mil. We are here to be a resource to Fort Bragg and Womack Army Medical Center by educating individuals on their TRICARE benefits and updating them on any changes in TRICARE policy. Thank you so much. We look forward to serving you and have a great day.
Hello, my name is Sheena Butler, and I'm a nutritionist for the Cumberland County WIC program. The Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC, is funded by the United States Department of Agriculture. WIC is a two-part program. Our focus is to provide all participants with nutrition education to help reduce the chances of developing health conditions. In addition, WIC is a pro-breastfeeding facility. We offer breastfeeding education and support to any participant who chooses to breastfeed. WIC offers supplemental foods such as milk, cheese, yogurt, eggs, tofu, fruits and vegetables, whole grain products, juice, and a variety of infant foods. So how do you purchase your foods when you go to the grocery store? In 2018, North Carolina WIC rolled out the eWIC card. This electronic benefit allows participants to purchase their WIC-approved food items when shopping at the grocery store. The eWIC card is very simple to use. During the checkout process, the cashier will scan the participant's food items, then the participant swipes their eWIC card. All approved WIC items will be deducted from their electronic benefit account. eWIC also has an app which allows participants to scan their food items at the grocery store from their phone. This helps participants to determine what is WIC approved.
Other features on the app track the participant's food balance from month to month and tells the participant what date their benefits begin and end. So who is eligible for WIC? WIC is eligible to pregnant women, infants, children ages 1 to 5, and women breastfeeding an infant less than 12 months of age. To participate, these individuals must be at a nutritional risk, have a family income less than 185% of the U.S. Poverty Income Guideline, and be a resident of North Carolina. Individuals receiving Medicaid, Work First Families Assistance, or assistance from the NC Food and Nutrition Services automatically meet the income eligibility requirement. For our military families, you may have some questions about what is considered income. No worries. For your convenience, we have inserted the 2020 Income Eligibility Guidelines and the military LES descriptions, so you know what counts as income for WIC. Now that you know about the Women, Infants, and Children's program, give us a call and enroll to receive your WIC benefits today. Cumberland County has 3 WIC facilities, but due to the pandemic, our normal in-office operations have changed. We are available by phone or email from 8 a.m. to 5 p.m. Monday through Friday. If an in-office visit is necessary, here are our new hours of operation and COVID-19 visitor protocol. So thanks for considering WIC for you and your family. If you have any questions, please don't hesitate to give us a call. We look forward to hearing from you soon, and as always, stay safe.
Hi, I'm Melanie.
And I'm Jennifer.
And we're Carolina's Cord Blood Bank at Womack Army Medical Center.
We want to share a wonderful program with you that is offered here when you come to deliver your baby. You can give birth to new life while helping to save another.
It's absolutely free. It's painless and harmless, and it really does save lives. In fact, this past January, 3 donations collected at Womack were used to treat patients with serious illnesses.
The program is umbilical cord blood donation. Melanie, why should someone consider donating their baby's umbilical cord blood after their baby is born?
Well, the blood left in the placenta and the umbilical cord after delivery contains blood-forming cells that can be used in cellular therapies to treat patients with cancers, sickle cell, and other life-threatening genetic diseases.
That's amazing.
Exactly. CCBB is a public cord blood bank that collects, tests, and stores cord blood donated by moms like all of you after the safe delivery of your healthy baby following an uncomplicated pregnancy.
We're part of Duke University School of Medicine, and we participate in the National Marrow Donor Program through a registry called Be the Match. We have been partners with Womack for over 11 years. But how does all this magic happen?
Well, when mom comes to deliver her baby, she just needs to let her nurse and provider know that she would like to be a cord blood donor. One of us will then go and talk to her and get the necessary consent forms signed. After the baby's born and the umbilical cord is clamped and cut, that precious cord blood is collected for donation from the remaining umbilical cord and placenta. There's no risk to mom or baby, and the whole process takes only a few minutes.
Is that it?
If a cord blood unit is collected that is suitable for use in a life-saving transplant, then a sample of blood will be drawn from mom's arm for infectious disease testing, and a medical history will be completed before mom and baby are discharged from the hospital. Strict confidentiality is maintained throughout, of course.
So mom's delivery plan is not changed or affected in any way, including if she wants to do delay clamping?
Not at all, because we're not taking anything from her or the baby. We collect after the baby's delivered using what would be considered medical waste after mom's body is finished with it.
That is correct. It's so awesome that we can use medical waste to save lives.
I know. How can someone learn more if they want to donate?
You can go online to ccbb.duke.edu or even bethematch.org/cord. And there are CCBB videos on YouTube with interviews from actual patients whose lives were saved by cord blood donors.
That's right. If you have any other questions, please call our office at 910-643-2517 or our cell 984-287-0154. Congratulations to all of you.
We look forward to seeing you soon.
Hello, my name is Bobby Brogdon.
My name is Joshua Hopkins. In addition to serving Fort Bragg as firefighters with the Fort Bragg Fire and Emergency Services, we are both members of the Child Passenger Safety Team that assists our Fort Bragg community and Cumberland County.
Each and every day that we are on duty, we are tasked to inspect and maintain the fire engines and apparatus that we operate. We're required to train on the equipment that we use and check out the firefighting gear that we wear. We strive to ensure that we are safe and ready to respond to whatever emergency we are called to.
Just as we know it's important to understand and properly utilize our safety equipment, we want to advocate to you, the parents and caregivers, to know the importance of their safety equipment. Primarily, we want parents to know how to safely transport their children each and every time we're in a vehicle. One way that is accomplished is through the proper use of car seats for children.
Our role as child passenger safety technicians is to assist and educate parents and caregivers with transporting their children safely and legally. Just as every child is unique and special, every car seat is a little different, and not all vehicles are the same. With this thought in mind, we hope to provide you with the knowledge, competence, and confidence to safely secure your baby, child, or toddler every time that they are on the road. We want to help ensure that the correct selection, direction, location, installation of your car seat, and the proper harnessing of your child is in place.
We would also like to take a moment and address another safety issue. As the weather is changing, on average, 38 children in the U.S. under the age of 15 die each year from heat stroke after being left in a vehicle. As terrible as these fatalities are, we want to remind all parents to never leave a child alone in a vehicle, regardless if it's running or not. It is crucial to look before you lock to ensure that the child is not still in the vehicle before locking your doors. Secondly, it is helpful to remember this important tip: strap before you wrap. The best practice is to properly harness and strap an infant into their car seat and then place the blankets or coverings on it. This way, the harnessing can be appropriately tightened and any covering can easily be removed as needed.
All of the education assistance that we described is provided free of charge to you. We encourage you to please come visit one of the 10 CPS check station locations on Fort Bragg. They're spread out all over the installation, so please reference our location sheet and call ahead to ensure that a CPS technician is ready and able to serve you.
When you come and see us, we encourage you to bring just a few items with you in addition to your car seat. Please also have the car seat's owner's manual and your vehicle's owner manual. If your child is also able to be present, that will be helpful as well, but we are still able to assist even if your child has not yet arrived.
On behalf of Fort Bragg Fire and Emergency Services, we thank you for your time and want to congratulate all the expectant parents. We look forward to seeing you soon as you prepare for your new arrival.
Hi everybody, this is Renee Harvey. I'm one of the labor and delivery nurses upstairs. I'm going to be taking care of hopefully you all whenever you come in for labor, but we're going to talk to you guys about childbirth education classes. So Womack offers 6 different childbirth education classes. We typically do them Tuesday, Wednesday, Thursday, one time a month over the period of 2 weeks. So for instance, the first 2 weeks of each month, Tuesday, Wednesday, Thursday, we have classes 1, 2, and 3. Next week we have 4, 5, and 6. So for first classes, we usually do pregnancy and labor. For pregnancy and labor, we're literally going to just talk to you about what the last trimester of pregnancy is about, usually some of the expectations that you can have about what your body's going to do. And then we venture into labor progression and how you're going to be able to kind of tell that you're progressing as average as your body is going to do. We also go over different signs and symptoms of emergencies that you should come in to be seen at, as well as telling you the number for labor and delivery triage to be seen if you need anything. The next class on that Wednesday would be New Parent Support Program. They come in and they talk to you and they go over many different things. They do infant safety and CPR training, things like that. On class 3, breathing and relaxation, that one happens to be my favorite. So basically, I kind of take over that class, but the gist is you already know how to breathe in and out, so we're not gonna teach you how to do that. That's inherent. However, we do teach you how to handle your pain. And we teach you how to expect it and to know what to do before you're gonna come over with the pain that you're gonna endure, and how to actually empower yourself for labor. So there's a difference of pain and suffering. And we take you from suffering back to just experiencing pain and tolerating it. The next class is class 4, that's interventions and C-sections. Out of all the classes, that's the scariest one. So please come there with an open mind. And I always tell my moms, embrace the knowledge, not the fear. So it's not meant to scare you, but we go over all the different types of monitors. If things happen to go awry while we're in labor, what we're gonna do to help you fix it, what you can do at home to kind of have ideas of, I should probably come in and get it checked out. So we go over that, and then we go all the way up through C-section to tell you what we do. We actually show you a video on how they perform the C-sections, layer by layer. That way you actually have an idea of what they do to your body if we have to undergo surgery. The class, which is going to be on the Wednesday that second week, is breastfeeding. Lactation, they come in, they show you all different types of latch mechanisms and how they coach you through that. And they give you great ideas on how you can actually maintain a successful breastfeeding relationship with the baby. Class 6 is going to be postpartum, newborn, and labor and delivery tour. I usually say class 6 is my favorite because it's the liquor store, but that has nothing to do with that class. This is actually going to be all about after you deliver, when we get you home. Most most moms have more emergencies actually at home later on that they wouldn't have recognized. So we encourage you and empower you to know exactly what to look for and what to do whenever you experience those things. So hopefully I'll see you guys at the classes soon. Due to pandemic protocol right now, we're not doing them face-to-face. So what we're doing in the interim is we're gonna have you come up whenever we do your induction. We do a little bit more education, and we also have you check out anything online that you can find out. And then whenever you come up, we go over questions and answers with you, and we encourage the centering program in the interim. Also, for a last little thing, whenever we do start the classes again, Tuesday, Wednesday, Thursday, 2 weeks in a row, and the breastfeeding or the birthing boot camp that we had talked about before this year, we're gonna hold off on that for right now until we can get the regular classes underway. All right, you guys take care of yourselves. Congratulations on the baby, and we will hopefully see you up here soon.
Congratulations on the upcoming addition to your family. My name is Carrie Bennick, and I work for the Armed Services YMCA. The Armed Services YMCA Fort Bragg Baby Bundle program supports new families just like you. All active duty Fort Bragg families up to E5 who are expecting or who have recently delivered can receive a baby bundle full of newborn essentials such as diapers, wipes, onesies, bibs, socks, hats, a book, and so much more. We're thrilled to offer you a sample of these items at the Womack Maternity Fair. To register for a full-size baby bundle, please register on our website, asymca.org, and search by location for Fort Bragg. Also, inside your baby bundle is a packet of information all about the Armed Services YMCA and all of the other programs we offer geared towards our military families that may interest you as well. Do you have older children? If so, you might be interested in before and after school care, summer camps, our Little Learners and Operation Hero programs. We're also opening Children's Waiting Room at Robinson Health Clinic soon to provide child watch during medical appointments. Operation Kid Comfort is a program which provides free quilts or pillowcases handmade by our volunteers to children with a deployed parent. Each quilt and pillow features pictures of the child and their deployed parent. Finally, we have a food pantry if you find yourself in need of non-perishable food items. No referral is needed for E5 and below, and we collect minimal information that's kept completely confidential. Please don't hesitate to contact the Armed Services YMCA Fort Bragg at 910-436-0500 if you need more information. Congratulations on your new baby.
Hi, my name is Brooke Browning, and this is Heather Ballard, and we are the public health therapists here at Womack Army Medical Center.
So you may be wondering what pelvic health physical therapy is exactly. Inside your goodie bag, there's a trifold brochure that discusses all of the different services we can provide and how you can obtain a referral to see us for an evaluation. Today, we would like to go over a few simple physical therapy techniques to help alleviate any of the common pregnancy-related pains that you may experience and empower you to have a healthy and positive pregnancy.
Some of the common discomforts of pregnancy that can be addressed by physical therapy include constipation, urinary incontinence, pain with intercourse, and pain in the low back, pelvic girdle, neck, and shoulders. Postural changes contribute quite a bit to these symptoms, so there are some common stretches that may help. Of course, if at any time these activities cause leakage of fluid, bleeding, contractions, or an increase in your pain, please stop and let your provider know.
Okay, so the first exercise is a piriformis or figure 4 stretch that we're going to go through. There's a few different ways to perform this, but we're going to go over a seated version that is usually a great option throughout your entire pregnancy. I'm going to have Brooke pretend like she's sitting down in a chair, and then she'll scoot to the edge. Crossing her ankle over her knee, she'll sit up tall and then hinge forward, keeping her back flat until she feels a stretch in her outer hip. At home, you would want to do this for about 30 seconds, and you can do that 3 times on each leg.
Another activity that can make your pelvis really happy is a lacrosse ball massage to help relieve some of the pain in the buttock muscles. You'll place the ball between you and the wall on the muscle, not on the bony parts of your back or buttock, and either hold for 30 seconds in each tender spot until you feel a release, or you can massage back and forth until you feel a little looser.
Lastly, we'll focus on loosening up the front of our chest and shoulders. At home, you would either use a doorway or a corner of the room and place your arms up in a field goal position like this. Then maintaining your upright posture, you'll take a step forward until you feel a stretch across the front of your chest and shoulders. Again, you would want to be holding this for 30 seconds and doing 3 repetitions.
So this is a tiny sampling of some very non-specific things that can help with pain management in pregnancy. If you're having discomfort, don't hesitate to ask your provider for a referral to physical therapy for evaluation and treatment. We can help you have a healthy and comfortable pregnancy and also guide you through your postpartum recovery. Congratulations on your new bundle of joy.
Hello, my name is Deidre Dalton. Hello, my name is Danielle McLean. We are part of the lactation team here at Womack. Our team consists of 4 lactation consultants, and we serve Womack families 12 hours a day, 7 days a week, including holidays and weekends. Each day we make daily rounds on the limited newborn care unit to assist each family with any breastfeeding concerns. We serve all areas in the hospital, including labor and delivery and NICU, if your family needs any assistance in these areas during your stay. We also provide outpatient services to help with breastfeeding challenges after discharge and have a hotline for mothers to call with questions or concerns. Please call 910-907-6157 to schedule lactation appointments and 910-907-8367 for all breastfeeding questions or concerns. Here, we offer a comprehensive lactation service to help to provide support to each family as they successfully overcome any challenges and strive to help each of you reach your breastfeeding goals. We encourage you to breastfeed your baby soon after delivery, usually within the first hour. Your baby will be placed skin to skin after delivery. Skin to skin contact helps your baby transition to life outside the womb, and it helps breastfeeding get off to a great start. Plan to feed your baby on demand, 8 to 12 times in 24 hours. Your baby may be sleepy in the first 1 to 2 days of life, and you may need to wake him or her to feed. We are dedicated to helping you and your baby as you learn how to breastfeed, and are available to answer any questions that you have during your hospital stay and after. Prior to delivery, we recommend for you to obtain your breast pump prescription. You should receive this at your prenatal checkup. Our goal is to provide a supportive and encouraging environment to help families bond in the first few days of their baby's life. So, congratulations on your new and exciting journey as parents. And we are so excited to welcome your family and share in this very special time.
Hello and thank you for your interest in the Womack Army Medical Center Virtual Maternity Fair. In this short video, we will discuss the role of anesthesia throughout the labor and delivery process, and hopefully answer some of the more common questions we receive. There are a few different techniques your anesthesia provider can use to help you through the labor process, but the 2 common techniques are spinal and epidural anesthesia. It is important to remember that your anesthesia provider will work closely with you to deliver the safest treatment for you and your baby. This will ensure you have the most positive birth experience possible.
Epidural and spinal blocks are a type of anesthesia in which local anesthetic medication, similar to that used for dental procedures, is injected into the spaces near your spinal cord and nerve roots. It is used to block pain from an entire region of your body, such as your belly, your hips, your pelvis, and your legs. Epidurals are more commonly used during childbirth, whereas spinals are more commonly used during cesarean sections. The technique for performing both procedures is similar, but not completely the same, due to differences in anatomical location of where the local anesthetic medication will be injected.
Position is key in the successful placement of your epidural or spinal. You will work closely with your nurse and anesthesia provider to get in the best position possible. We will ask that you sit sideways on the bed to prepare for the placement of the epidural or spinal. We will also ask that your significant other leave the room during the placement to maintain sterility and safe environment. Once you're in the correct position, your nurse will be in front of you and your anesthesia provider will be behind you. Your calves or just your feet will be dangling off the bed. We will ask that you place your chin to your chest and relax your shoulders. You will then push out the lower of your back towards the anesthesia provider. This may be referred to as a scared cat position, a shrimp position, or just asking that you hug your baby like a basketball. This allows the vertebra to open up and the successful placement of the needle. Once we are able to place the needle and inject the medication, the needle will come out. If it's an epidural, a small, flexible catheter will remain in place.
Once that is in place, we will secure it to the back and you will be able to sit in the position of comfort. Once that happens, your significant other will be able to come back in the room and remain with you for the remainder of your experience.
Like other medical procedures, there are potential risks and side effects that are associated with both epidural and spinal anesthesia. Some of the most common risks include back pain, infection, injury to the site, nerve palsy, and a headache. Luckily, a headache can be alleviated by both IV fluids, caffeine, rest, and an additional procedure called a blood patch. Even more rare, some women can actually be allergic to the local anesthesia itself. Rest assured, our team here at Womack Army Medical Center of certified registered nurse anesthetists and anesthesiologists stand ready 24/7 and on call to meet any and all of your laboring needs. Congratulations, and we look forward to working with both you and the addition of your new baby.
Welcome to this year's Maternity Fair. My name is Rhonda Barnes, and I'm one of the New Parent Support Program home visitors. For those of you who are not familiar with New Parent Support, let me share a little bit about our program. We are registered nurses and licensed clinical social workers who provide a range of educational services and support to families. The family range that we support is from birth, or actually expectant parents, to those who have a child in the home 36 months and under. We provide home visits. Now with our home visitation program, we come into the comfort of your home and provide education on topics such as sleeping, nutrition, deployment, stress management, potty training, and positive discipline. Those are just some of the topics. We also provide other classes, one of which is a 4-week series called Preparing for Childbirth. And you will attend that 2 days in 1 week, and the following week you attend another 2 days. But you learn all about from labor and delivery, comfort measures, to having the baby, as well as safety in the home. Another service we offer is TPR, and that's a monthly program, and you would need to register for that. We provide play mornings, and our newest one is called Walk and Play. And all of the information you'll be able to find on our flyers. We also offer a prenatal and postpartum.
It's okay. Don't forget. So if you just deep breath in, go back about a sentence, and then just keep going, because I can cut right where you made your boo-boo and transition to the better shot. So keep going.
Our next program is the Prenatal and Postnatal Empowerment Group, and we offer that weekly. And the last class I'd like to share with you is for active duty soldiers. This is our Army P3T, and we have a prenatal component and a postnatal component. And if you are interested in any of those programs, please call us at 910-396-7951, or you can go to our website at Fort Bragg Army New Parent Support Program. And thank you for being a part of this wonderful event today.
Hi, my name is Dr. Tori Como-Plowden, and I'm Chief of the OBGYN Department at YMCA.
My name is Luis Correa. I am the Division Chief of Reproductive, Endocrinology, and Infertility at Womack Army Medical Center.
Both Drs. Correa and I are fellowship-trained reproductive endocrinology and infertility specialists. And that basically means that we specialize in helping couples become pregnant. The typical definition of infertility is a couple trying to become pregnant with regular intercourse for 12 months without any success. Certainly, in certain situations, that definition can be altered. So in women who are 35 or older, we typically recommend that they try to get pregnant for 6 months, and if not successful, then they get referred to the Reproductive Endocrinology and Infertility Clinic.
And despite rumors, access to our fertility clinic is easy. All you need is a referral from your primary care provider. They will order the necessary labs and radiology studies prior to you and your partner coming to see us. We have a variety of treatments that we can provide. It's not just in vitro fertilization. It can be something as simple as just giving you a pill to increase the ovulation process to including also an insemination or intrauterine insemination to all the way to in vitro fertilization. All those services are provided in our clinic. Unfortunately, some of them are not covered by TRICARE, and there may be a charge for some of these to include the insemination and in vitro fertilization. However, in comparison to the civilian world, those prices are much, much less, and it makes it more accessible to our population.
And certainly, we take care of couples who are experiencing infertility, but if there are same-sex couples or single women who are interested in becoming pregnant, you're also welcome to come to our clinic and discuss options for conceiving.
Ultimately, there are women that don't have a partner or haven't thought about conceiving, but want to have that possibility in their future after their profession or after they meet somebody. And one other thing that we can provide is oocyte cryopreservation, or just freezing your eggs for future use. So that's something else that we can provide to our patients.
So in summary, here at Womack Army Medical Center, our reproductive endocrinology and infertility department is brisk. We have multiple modalities to treat you and to hopefully help you achieve your dream of becoming pregnant.
Hi, my name is Sonia Samuel, and I serve as your patient advocate for the OBGYN department. I also provide support to the Women and Newborn Unit, which includes labor and delivery, the maternal ward, and neonatal intensive care unit. Our goal at Womack is to provide beneficiaries with quality patient-centered care. We believe that nothing is more important to us and to you than your health. So we work hard to provide the best care possible, so you can return home quickly and resume your day-to-day activities. As a patient advocate, I am here to acknowledge and support the patient's right to present grievances when patients feel that their needs are not being met or recognized. Our team provides a specific channel for the resolution of concerns, as well as an avenue to share feedback, whether good or bad. My role is also one of education. I am here to help beneficiaries understand and execute their TRICARE benefits and utilize relationships across our platform to help facilitate care. Like you, I too receive care at Womack, so I'm very familiar with utilizing our health benefits. Additionally, we are not confined to just information and resources at Womack. We are able to assist with information within the Fort Bragg community, such as the New Parent Support Group, Army Community Services, as well as Child and Youth Services. As your patient advocate, I am available as an outlet for you to discuss any questions you may have about your OB care, such as appointments, referrals, and questions about policies and procedures. In closing, please know that I am here for you and your family. We believe that when we know better, we are able to do and be better. We can't do that without your feedback. Please don't hesitate to contact me through our team's secure voicemail box at 910-907-6036 and choose the OBGYN clinic option, and I will follow up with you as soon as possible. Thank you for trusting us with your care.
Hi, my name is Captain Brent Coker, and I'm one of the certified nurse midwives here at Womack Army Medical Center. In honor of National Midwifery Week coming up in October, I'd like to take a minute to tell you what I do and the role that certified nurse midwives play in your pregnancy, your labor, and beyond. A certified nurse midwife is a nurse that has furthered his or her education and has gone on to obtain an advanced practice degree in midwifery. We have a bachelor's degree in nursing, and in addition to that, either a 2-year master's degree or a 3-year doctorate degree. Certified nurse midwives are trained to care for women throughout her entire lifespan from puberty to menopause, with a focus on a woman's pregnancy, birth, and postpartum periods. Midwifery is a practice of empowering women. We believe that the best care is given when it is discussed with the patient and her family, and the decision-making process includes not only the provider, but the patient and her family as well. By focusing on education, patient-centered care, and shared decision-making with our patients, we strive to give our patients the pregnancy and birth that they desire. We are proficient in caring for women with normal pregnancies and birth. However, if complications do arise during your pregnancy, in most cases, you can still continue to see a midwife. And that's one of the reasons why I love Womack. The nurses, midwives, and doctors will all work as partners in your care. Therefore, if a problem arises, consultation or collaboration is easy. Some misconceptions that women have of midwives is that you must have an unmedicated, natural birth in order to be managed by a midwife. I would say that most of the women we care for in labor has some sort of pain management, whether that be through their IV, epidural, or nitrous oxide. We also manage a lot of our patients coming in for induction of labor for reasons such as late-term pregnancy, gestational diabetes, or high blood pressure. From all the midwives at Womack Army Medical Center, thank you for letting us be a part of one of the most exciting times of your life. We look forward to continuing to care for you, and we cannot wait to meet your newest member of your family.